We frequently talk about heart health here on Sonoran Living Live. In fact, two of the most common surgeries performed today are angioplasty and coronary bypass. Research shows us up to 50% of angioplasty patients experience another blockage of the same artery within just 6 months of the original procedure. In today's Living Well with Dr. Sam, naturopathic medical doctor Sam Walters, founder of Wellspring Clinic, is back to talk to us more about how you can clean your arteries safely and naturally. So great to see you. So what happens when our arteries clog?
Well, due to our lifestyle and our diet and all the other junk that goes through our body, we just plug up. You know, like if you took an old water pipe in a basement, you cut it in two, it's been there for 50, 60 years, and the water pipe's clogged up. Water doesn't flow through there. So that raises your blood pressure. It creates a cardiovascular disease. It kills more than 50% of the people that die in this country. Here's kind of an example. Here's actually a cross-section of a blood vessel that shows it's nice and clean and normal. And here's one that's all plugged up. And this is what we see when we do our test, and this is what leads to the cardiovascular events.
And it could be lifestyle, it could be what we're eating, it could be a number of things, correct?
Yes, it is a lifestyle. It's what we're eating. You know, cardiovascular disease, it wasn't a big a deal around 1900, but it is today because of the trans fats, the sugars, the junks, the medicines we take.
And this has hit you personally hard. You've lost some family members.
Yes, matter of fact, I lost my father and a couple uncles, and it turns out we have something that kind of runs the family genetically. And this is a common problem that we see. When the big artery comes up out of the heart, it gets down right behind the belly button, it splits. So you have a big artery down the right leg, one down the left leg, and right where it splits is where that accumulates, and that's what causes an aneurysm, abdominal aortic aneurysm. It's a common problem. So this is one of the first things we look for when people come in. We do our examination, and we have a way of cleaning this stuff out. It's phenomenal.
I was going to ask about that. It's called PTX Therapy, and what is that and how does it work?
PTX Therapy is an IV that takes about an hour and 20, 30 minutes, takes about 20 of them overall, and we learned this in Switzerland. They've been doing it for 50-some years, and they just reduce the odds big time of the heart attacks and strokes. And if you've ever had stents put in your body, it'll help keep those clean, help prevent the next ones. It'll clean out the arteries where you can walk and talk and breathe again. And
so what does the therapy do for our bodies exactly, and how is it doing it naturally?
Naturally, it's a natural substance that comes out of soybean. And we have some special supplements that go along with that called PTX capsules. And they literally dissolve the plaque in the body, and it gets rid of it. It does it in a natural way, no side effects, no dangers in it. It's very impressive. We've done it with thousands of people. We just don't have failures with it.
And so it's a natural product, and it's a pill that you just take, and it's kind of like a roto-rooter for our arteries, if you will.
Yes.
It just kind of cleans them out?
Yes, that, and along with the IV. The IV is the big gun.
So what if patients who have clogged arteries or maybe have a stent in, what are they saying about this product? Are they what kind of results are they seeing, and does it stop the progression?
Oh, it stops the progression, and it cleans out what you've got. You know, it's an accumulative thing. It happens in people, time they're 50, they have this issue. We do some special testing in our office. Our goal this year is to save 50 people from a cardiovascular event. So far, we've saved 15. So hopefully we can reach our goal with the first year. It's pretty spectacular.
That is wonderful. 15 people that you've saved with this pill.
With this, and along with some diagnostics, a new type of CT scan that we're putting our patients through.
Well, so how quick can this test be done?
It can be done in a matter of about 30 minutes. Now, we've had a few of those people we've had to send in and get cracked open and have their heart rebuilt. We've had some have had to go get stents because they were just too far along. But those are the ones that definitely want to do our PTX therapy to clean it up so it doesn't come back and prevent you from having those new stents. It works with, it's phenomenal stuff.
I can imagine. I mean, when you talk about 50% of the people go back for the same thing after an angioplasty and possibly could be prevented with a pill, it's mind-blowing.
Well, it's pill, it's lifestyle, it's diet, and it's the PTX therapy, the IV and the capsule. So it's a combination of things that we do.
Absolutely.
And we monitor these people so we can actually see what's happening. We want you to feel better, which people do, but we want to see the evidence when we redo those labs and so forth.
All right, Dr. Sam is determined to save 50 lives this year alone. So we were going to make sure that we help you with a special offer if you would like to go in and see if you are at risk. Call today to receive 50% off on a new patient consultation exam. That is a savings of $105. This offer is good for the next 30 days only, so call today. Wellspring Clinic is located at 8070 East Morgan Trail, Suite 200 in Scottsdale. To book an appointment, give them a call at 480-946-9222 or online at wellspringclinic.com.